Hi everyone, and welcome back to Dr. Anti-Aging and Herbal-medicine TV. I'm Professor Lee. Today, we'll be exploring a topic many of you are concerned about: how to naturally manage oral health problems like cavities, gum disease, and bad breath using simple herbal goggles. I introduce a DIY herbal mouthwash recipe that uses 3 medicinal herbs: licorice, clove, and green tea, all of which have been clinically proven to improve oral conditions. Oral diseases such as cavities, gingivitis, and mouth ulcers are not just inconvenient, they can also impact your overall health. The main causes include excessive sugar intake, poor brushing habits, smoking, stress, and nutritional deficiencies. Even today, billions of people suffer from untreated cavities, which often lead to chronic inflammation, gum disease, mouth ulcers, and in severe cases, tooth loss or even temporomandibular joint disorders. Moreover, oral bacteria and inflammation can affect cardiovascular health, diabetes, and even cognitive functions. Even with modern dental care, long-term oral health requires consistent self-care. For those worried about antibiotic resistance, harsh mouthwashes, or sensitive oral mucosa, herbal goggles can be a gentle and effective solution. Herbal therapy has shown significant benefits in clinical studies, improving toothache, infections, ulcers, and gum inflammation through antibacterial, antifungal, anti-inflammatory, and antioxidant actions. Medicinal herbs are also being studied for managing complex oral conditions like recurrent ephthous ulcers, oral lichen planus, leukoplakia, and Sjögren's syndrome. Now, let's briefly go through 11 clinically supported medicinal herbs known to help with conditions like periodontitis, tooth decay, mouth ulcers, and halitosis. 1. Licorice root, anti-inflammatory, antiviral, antibacterial, effective for gingivitis and mucosal healing. 2. Clove, contains eugenol, a natural local anesthetic and antimicrobial, used for toothache and gum infection. 3. Green tea, rich in EGCG and antioxidant, helps reduce plaque, bad breath, and gum inflammation. 4. Sage, reduces oral bacteria, bad breath, and inflammation, traditionally used in mouth rinses. 5. Chamomile, calming, anti-inflammatory, anti-allergic, soothes ulcers and inflammation. 6. Phenols, gentle on gums, with antioxidant and antimicrobial properties. 7. Gardenia, traditionally used for inflammatory gum lesions and oral ulcers. 8. Baikal skull cap, rich in flavonoid with strong anti-inflammatory and antimicrobial action. 9. Thyme, thymorin thyme inhibits oral pathogens and helps prevent cavities. 10. Wild ginger, analgesic, antimicrobial, anti-inflammatory, potential for relieving pain and infection. 11. Chinese gold thread, berberine helps treat gum inflammation, periodontitis, and other oral regions. Among these, today we'll focus on the top 3 herbs with the strongest clinical evidence. 1. Licorice root, key compounds glycyrrhizin, glycyrrhizin, flavonoid. Effect: promote mucosal regeneration, reduce inflammation and bleeding in gingivitis, and inhibit harmful oral bacteria. Applications: widely used in mouthwashes, lozenges, and gum care toothpaste. Clinical example: licorice gel applied to radiation-induced stomatitis patient showed significant healing. Mouthwash containing licorice extract reduced plaque and gum bleeding in clinical trials. 2. Clove, key compound eugenol, a natural anesthetic. Effect: relieve toothache with local numbing, suppress cavity-causing bacteria and candida species. Clinical data: gargle with clove oil for 4 weeks, reduced gingival bleeding. Recognition: clove oil is approved by WHO as a herbal dental anesthetic. 3. Green tea, key compound EGCG, catechins L-theanine. Effect: EGCG inhibit acid production by cavity-causing bacteria, protect oral tissues through antioxidant and anti-inflammatory action. Evidence meta-analysis show green tea-based product significantly reduced gingivitis. Gargling with EGCG solution for 2 weeks improved plaque and gum health. Now, let me show you how to make DIY mouthwashes at home using the top 3 clinically supported herbs for improving oral health: licorice, clove, and green tea. 1. Licorice mouthwash. Use 3 to 5 grams of dried licorice root in 250 cc water. Simmer on low heat for 10 to 15 minutes. Strain and cool. Gargle 15 to 20 cc for 30 seconds, 2 to 3 times a day. Store in the fridge and use within 2 days. Caution: long-term use may cause swelling by pseudosteroid effect. 2. Clove mouthwash. Use 1 to 2 grams dried clove bud in 250 cc water. Boil for 10 minutes. Strain and cool. Gargle 10 to 15 cc for 20 to 30 seconds, twice a day. Store refrigerated. Use within 2 to 3 days. Reduce dose if you feel a burning or numbing sensation. For kids, dilute to 50%. 3. Green tea mouthwash. Use 2 to 3 grams dried green tea leaves. Dip in 250 cc of 80 degrees Celsius water for 5 minutes, then cool. Gargle 15 cc for 20 to 30 seconds, 2 to 3 times a day. Refrigerate and use within 2 to 3 days. If you feel jittery or anxious due to caffeine sensitivity, reduce the amount and absorb. Let's wrap up with a few helpful herbal mix tips. For bad breath, combine clove plus cinnamon. For weak gums, combine licorice and green tea. For frequent mouth ulcers or wound, always include licorice. It not only reduces inflammation and oxidation, but also forms a protective mucosal film and accelerates mucosal cell migration and healing. Oral health is not just about aesthetics. It's a cornerstone of total body wellness. Try herbal garlic once or twice a day and experience the difference. If you have any question about herbs or health, leave a comment below. Nature meets science. This is Dr. Anti-Aging Herbal-medicine TV, and I'm always here to help you stay healthy.